Hey, welcome in. This is the Steve Gill Show. Glad to have you with us and encourage you to be part of the show. Just dial in at 800-688-9522. You can also send your comments via email, steve@gillreport.com. And as always, go to the website, gillreport.com, GILLREPORT.com. Click on the Daily Notes button. Scroll down. You'll find links to the stories we're talking about today, including Steve Cohen's comments on the floor of the House. So much for the new Democrat civility as he compares his Republican House colleagues to Nazis, says that the repeal of Obamacare is akin to the Holocaust, uses the term blood libel, and then also throws out some distorted information about the Congressional Budget Office numbers. Congressman Paul Ryan of Wisconsin dissects those bogus CBO claims, and I've got that video linked up at gillreport.com as well. Also want you to check out the grenade machine gun. That's the star of the SHOT Show out in Las Vegas. This thing shoots 340 hand grenades per minute. Yeah, I don't know, that I really need one. I know I really can't afford one, but man, I'd sure like to have one. Just got to put it in the living room and say, hey, you want to come over and see my machine gun? Shoots hand grenades. You'd have all the friends coming over. Illegals are costing L.A., Los Angeles, $600 million a year in welfare cost alone. We've got that detailed at the website. And finally, in terms of the graphics that are of concern, the vitriolic hate speech, nobody can outdo the Democrats in Missouri, where the Boone County Democrats are hosting a 2011 chili supper next week. And in their mail-out, they not only have a new logo that notes that the Democrats in Missouri are targeting 2012, they also feature a baby in a cook pot surrounded by vegetables as they note that their chili supper is coming up. So apparently they're cooking and eating babies in Missouri, if you're going to believe that graphics mean what you really mean. I guess that's why the chili tastes funky in Missouri. You can see that mail out at gillreport.com. I encourage you to check out the daily notes, and we'll update them throughout the course of the day. We've been talking a lot about health care. Obviously, the repeal of the Obamacare plan in the House will now move towards a potential vote in the Senate. And to kind of bring it home to Tennessee, we're joined in studio today by Mary Mancini. She is a former talk host herself. She's now executive director of the Tennessee Citizen Action Organization, Tennessee Citizen Action. You can go to their website, tnca.org, tnca.org. And Mary, good to have you in studio.
Thank you. I'm a little discombobulated at the moment because I didn't know they were cooking and eating babies in Missouri. So I'm a little freaked out, Steve.
I'm not going to their chili supper. I've been to a lot of chili suppers. I've been to Chitlin suppers. I'm not going to a chili supper, just in case. You never know when they put a baby in a cook pot.
How are you?
I'm doing good.
Yeah, it's been a long time.
Yeah,
Thank you for having me on.
Deal, and you got a new gig now with Tennessee Citizen Action. And what is Tennessee Citizen Action for folks who don't know?
We are a public interest and consumer rights organization. We've been around for about 16 years.
And what, obviously your focal point right now is on Obamacare because there were a couple of stories this week on Channel 2 and Channel 5 featuring, I guess, one of your advocates who was suffering from multiple sclerosis, who was featured in the stories. Obviously, healthcare is one of the things you're focusing on right now.
It is. And I just have to say I was watching that, of course, like with my eyes covered because I hate watching myself on TV. But, I was watching it and then all of a sudden you show up. I'm like, really? Really? So it's almost like a one-for-one. It's like Mary Mancini's going to be on the TV, Steve Gill on the TV.
Well, the interesting thing, though, and we pointed this out earlier this week, is that the mainstream media really – even at the local level, is so biased they don't even see their biases. They had completely packaged their story that you and this woman had put together, and they were done. And it wasn't until it was getting ready to air that somebody said, I guess, should we tell the other side of the story? So they literally rushed out, grabbed a 10-second comment from me in the Target parking lot.
Well, now wait a minute.
In Cool Springs. But the reporter thought her story was done without any balance whatsoever.
She was doing that story in a rush. She was rushing it all over town to get the report. She rushed. I did it in my office parking lot. So anyway, but that's regardless.
But the woman that they featured, this woman, she was on Channel 5 too. So clearly you guys were pushing her out there as a story.
Well, yeah, and not only Nicole, who is she's a self-employed Tennessean, but we also had a small business person and a registered nurse.
She's carrying a Prada bag, and she's driving what looks to be a brand new Acura. How destitute is she? She's got a Prada bag.
Where did you see it? Okay.
On Channel 5, sure, she had a Prada bag, and she had her Acura that she was getting into with her walker.
Have you heard of knockoffs?
So she's also ripping
Oh my God.
off the copyright. She's stealing. That's a copyright. That's illegal. So she's not only stealing money from taxpayers, she's stealing from Prada.
You are hilarious.
Is it a knockoff
You're
or is it real?
hilarious. I don't know. I didn't see the
Well, I'm assuming
bag.
it's real. I'm assuming she's not a thief. I'm assuming it's $4,000
Let's talk
bag.
about what we both agree on, which is I think we both agree that, and I think we can agree on this, that we want health care for everyone.
I think we want good quality health care
Absolutely.
that's accessible to everyone, which we already have.
Absolutely.
We've got the best health care in the world.
And the accessible to everyone is the part that is.
Well, you can go to any
different.
emergency room in America today and you got health care.
And who foots that bill?
Well, we do.
Which is a problem.
And
That's
we
a
ought to
big
be
problem.
making people
$42
pay
billion
more
a
of
year.
their health care. And giving free health care to 25-year-old children isn't doing that.
Wait, nobody's talking about free health care. We're talking about accessible and affordable health care. The people who are getting those 26-year-old kids.
Children, yeah.
Yeah. Yes,
Well,
because
I'm a 50-year-old child of my parents.
Well, no, let me just finish what my point is. Their parents are paying for health care. Nobody's getting free health care. They're paying for it.
Except that under Obamacare, they are now trying to impose restrictions on the ability of the health insurance companies to raise the rates to include those kids. So, that is at that point free health care because they're not having to pay for it.
Well, let's talk about a little bit of a scenario.
That's why they're treating them as children under the household so that they don't have to charge any more money for it, or the insurance companies aren't allowed to charge more, even though there's an additional risk. It's like if I am going to cover your car insurance, but you're also going to be forced by the government to provide new tires, windshield wiper blades, and gas fill-ups, but you tell the car insurance company, but you can't charge any more for that. The insurance company will go out of business, which will get us to the government-run health care, which is, I'm sure, your goal and the Obama administration's goal.
You have no idea what my goal is. My goal
Tennessee
as
Citizen Action has said that they want
affordable in our mission statement.
Single payer plan. Single payer's
No, we haven't. No, we haven't. Our mission statement basically says that we are there to work tirelessly on behalf of the citizens of Tennessee to improve their overall health, well-being, and quality of life. That's in our mission statement. Listed in our mission statement is to help Tennesseans get affordable and accessible health care and good health care. That's what's in our mission statement. But let's go back a second.
But your allies include SEIU, which has made it their plan to push the Obama plan, which is government-run health care. So your allies
It's not government-run health care. The Obama plan is not government. Health care reform is not government-run health care. The way this works, it's all going to be with private insurance companies, right? So anything that people are going to be buying, employers, private insurance companies, and the exchanges that are run by the states, by the way, that's all going to be done through private insurers.
As long as the private insurers continue to exist, but you cannot impose on the insurers. You have to cover all this, but you can't charge more for it.
Well, that's not true. Let's talk a little bit about
that. Is part of the plan.
Let me throw out a little scenario to you, the way it works now and the way it's hopefully going to work in 2014. So,
let me ask that real question before you get to that. Okay. They rushed through this plan. People didn't even read it. They rushed it through in the dark of night. They rushed it through without any member of Congress reading it.
Let's talk about rushing the repeal. They didn't have a plan to replace it, and they're going to work on a plan now.
Well, we didn't have a plan before they put it in. The bottom line is they rushed this thing in. As you point out, it doesn't go into effect into 2014. Mm-hmm. They've given exemptions to hundreds and hundreds of thousands of people to be under the plan they said was so important that they passed right away. If it was so important to do it right away, why wasn't it important to put all the federal employees into these same exchanges, to put all of Congress under these exchanges? Why are they granting exemptions to their labor union buddies? If it was so important that we do this and do it right away, why didn't they put it all into effect right now and put all these other people under it if it's so good for us?
What's so good for us, what's in effect now, and the way this is working is it's a gradual implementation, like you said. There are consumer protections in the bill right now that we're concerned with that are helping Tennesseans right this very minute. One of them, whether you agree or not that it's a good thing, and I happen to think it's a good thing, is that I have to look at my notes, but about 23,000 young adult Tennesseans, right, who will now be able to stay under their parents' plan. And these are people that maybe still be in college. They may be just starting out, maybe just getting a job. Not every employer, as we know, provides health insurance. So this is a good thing.
And you're going to have less employers providing health insurance under this plan because it will be cheaper to dump their employees and pay the fines than it will be to pay the cost of health insurance for their employees. So millions of people are going to be dumped into these exchanges with half the doctors telling us that they're going to get out of the business.
I don't know where you heard that.
all these polls of doctors that are saying 45% are going to leave the practice of medicine. You're going to have half the doctors. This plan also stops the construction and has stopped the construction of at least 45 physician-owned hospitals. You're going to have less facilities, less doctors, more people being dumped in under this system. That's a disaster for the healthcare system. That's not going to help anybody.
Let's go back to the story I was going to tell, which is we also had a woman who is a small business owner, and she talked about not being able to provide insurance to her small business employees because she can't afford it. But she has a personal plan. So she wakes up one day and she's in intense pain. She has what was it? She has spurs that have developed on her cervical spine, which it gives me the chills just thinking about it. I'm like, oh, it sounds horrible. She said it was painful. She had the operation. She had insurance. She had the operation. Now, remember, this is a small business owner. Then she went to her insurance broker, and at some point after she had that, and she said, "I want to look for other insurance. Right? I want the ability to have this choice to other insurance." Her insurance broker said to her, "No, you cannot, because nobody else will insure you because you have this pre-existing condition."
I thought Kennedy Kassebaum was supposed to have
where
cured
is that free market? That gives you no
business.
Choice. That means that you're stuck in a plan with an insurance company who can
Right,
raise
so
rates whenever they want.
That without dismantling the system for 350 million people.
Kennedy
Kassebaum was supposed to fix the pre-existing condition. We were told by the Democrats that Kennedy's bill 20 years ago was going to solve that problem. Were they lying to us? We'll talk more with Mary Mancini in just a moment. She's with the Tennessee Citizen Action Organization in Tennessee. Go to tnca.org, and we'll talk more about it in just a moment. This is The Steve Gill Show.